years, we can see that pollutants, for example, smoking has decreased very significantly in buildings. Exposure outdoors to lead and indoors has very significantly reduced. But at the same time, we've introduced vape, which is a new set of pollutants that we don't fully understand. We're getting more aware of microplastics, and increasingly, the number of chemicals that we're exposed to in our daily lives has probably increased. And then we also find that there's this growing evidence base that we need to understand the health impacts, and we can see that there is more and more data coming through on indoor air and health. And I think you can see this in some of the reports, the guidance, etc. The majority of these are geared towards domestic environments, but the Royal College of Paediatrics and Child Health, their report from 2016 that they're hoping to update on indoor air quality and the effect on young people and children. NICE have their guidance on indoor air quality at home. The Chief Medical Officer's annual report 2022, where it highlighted indoor air quality as a clear priority. And then I think we shouldn't forget that this is actually about real people and the real harms for real people. And the sad case of Awabishak as just an example of how devastating the effects of poor indoor air can be. I think one of the real challenges with indoor air is, just an illustration of a home here, but the numbers of different sources. So, the indoor air that we breathe is also the outdoor air. So all of those pollutants in outdoor air can come into buildings, but then we have a whole raft of indoor sources too. Many of you will know these very well. But we have challenges in knowing the health impacts and the relative importance of these. There are some which are really well established. So we know the health impacts of radon, we know the health impacts of carbon monoxide. We can use those to set appropriate threshold levels and interventions. But there are many other pollutants that we're exposed to in our daily lives where it is quite uncertain as to how significant those pollutants are. And then, of course, it's not feasible for us to measure and understand every single one of these pollutants, because there's hundreds, if not thousands of them that we are all exposed to. We're very much coming at these things from a ventilation perspective. And if we look at guidance and things, we know that ventilation is in guidance, it is in regulation. I think we can probably debate forever as to whether that is complied with and to what extent that compliance is there and how easy it is to enforce. But there is guidance around ventilation rates. This just shows a little bit of historic guidance around here. And you can see if you go back to 1895, ventilation rates were proposed around managing health, and particularly infectious diseases, on recommended 14 litres per second per person around that time. But over the years, as I guess the challenges of infectious diseases were either downplayed or we had antibiotics, so we kind of perhaps didn't think about them quite so much. The ventilation rates worldwide tend to follow odour and comfort and energy rather than air quality and health. There's a real question about where we should be. A review in 2011 suggested 25 litres per second per person for health. I've seen others which suggest more recently the equivalent of about 14 litres per second per person for health. That doesn't all necessarily have to be fresh air. Some of that could be recirculated, including filters. It is quite hard to identify what those numbers should be. And even if we can identify what those numbers should be, thinking about how that is realistically implemented and enforced in buildings is a challenge. Of course, this is just ventilation. The values for any of the other air pollutants really are missing. We don't have a good benchmark to go with. What do we know about buildings? And again, this is sort of following on from some of the information Abigail showed, but I think over the past few years, it's become really apparent that we know relatively little about the majority of buildings, and that what we do know tells us that they are variable, and there are a substantial number which do not meet what they should meet. And this is a set of data from a study led by Tim Sharp, who's at the University of Strathclyde, looking at domestic environments and their measured ventilation rates compared to the building regulations. And what you see is you compare them to Part F 2010, relatively few meet or exceed those values. Even if you look at the 2006 regulations, there's still quite a substantial number that don't meet those regulations, and the different shadings are for whether they are passive house dwellings or non-passive house dwellings. But we can say even in new buildings, which should meet building regulations, we have a number that just don't meet those regulations. This is one of Abigail's slides from the studies that she mentioned earlier, really just to illustrate some of those CO2 values that are measured and illustrate that variability. And again, you will have all been aware of this variability that you see in buildings and their ventilation, depending on the systems that are installed, depending on the occupant behaviours, depending on the numbers of people, depending on the building type. And there's quite a substantial variability in this that's quite hard to sort of have a one-size-fits-all on. I think it's also worth mentioning that we've done some survey work, again as part of the Protect study, during the pandemic, looking at understanding in businesses about how well ventilated buildings are and how confident people are they can build them, ventilate them. And we asked several thousand people here. I can't remember the exact numbers. I think the users were in the sort of around 10,000 and the controllers were around 2,000. So controllers, essentially the people who are responsible for ventilation in buildings. Users are just employees in workplaces. But what we can see there is that that there's a much greater concern but a much greater confidence for those who control compared to those who use. And if we think of those who use those buildings in workplaces on a day-to-day basis, those who are, in terms of how confident are you that you can ventilate your building well, only 36% are confident that they can. So that's really quite a substantial proportion who are either not confident or are not sure whether they can ventilate their building well at work. So if you think where monitoring comes in, if we look sort of over the past, sort of historically in a sense, where we currently or recently have applied monitoring, I think in many cases it's applied to look for very specific hazards. So we widely use carbon monoxide as a sort of threshold value. We monitor for radon to understand where there's interventions needed. There are certain workplace exposures where those monitoring is applied. And often these are of the form of a very local monitoring approach to give a threshold value or an alert, an alarm, or to make people aware when action is needed. And often these are for hazardous substances. There's a certain amount of monitoring done to inform performance, so particularly for specialised ventilation, whether it's local exhaust ventilation, ventilation in operating theatres, ventilation in certain specialist settings where measurements are taken as part of the commissioning and validation of those systems. Air quality monitoring is used quite regularly in terms of environmental impacts assessments. That's outdoors and sometimes indoors, supporting where we might want to design buildings, where we might be particular concerns over exposures from certain settings. We use, and I suspect many of you here will use air quality monitoring to investigate specific problems associated with buildings, again, indoors or outdoors, looking for particular pollutants or to identify where there are some issues. And then, of course, research studies routinely use air quality monitoring. The challenge with these is most of these are done at a single point in time or over a very short time scale. So they're a snapshot sample, or they are just providing some local information, for example, your background carbon monoxide detector to warn if there's a risk. And in some cases, these will be regulatory type measurements. So they will be measurements that are using a scientific grade instrument and could well be used to support evidence in a more of a regulatory type environment. But I think building on from the first part of this session, there are a lot of new opportunities out there. So the thing that's probably really changed over the past 5 years or so is the widespread availability of much lower cost sensors. So, you know, temperature and humidity sensors have been around for quite a long time. Then CO2 sensors came along, and increasingly now we've got sensors which will do particulate matter, volatile organic compounds, some of them which will be even quite specific. And these sensors are pretty low cost compared to the conventional scientific grade instruments. They're easy to use, usually plug and play, sometimes with a mobile phone interface or simple aspects like that. So that has now become much more widely available, not just for people who are trained users, but now for the public and for businesses. Alongside that, we've also got the ability to network those sensors, push that information together on a cloud, access it via data dashboards, and start to look in real time at what's happening in different environments. That's when in indoor settings. The same is also true outdoors. So alongside the scientific grade regulatory instruments, there is now growing networks of outdoor air quality sensors. If you go on something called Purple Air, you find them. There's various others out there which build this richer picture of the outdoor environments. And in certain cities, there are even urban observatories which provide higher levels of information there. And then we also now have this growing potential to connect data. So we can take data from indoor environments, from outdoor environments. We can bring that data in a particular geographic region. That might be quite small regions, or might be across a whole city. Bring it together with health data, with societal data, built environment data, economic data, infrastructure, public services, etc., and start to build those links between the environments that we live and work in with the health outcomes. And there's some nice examples of this, particularly in Bradford, where they have now something called Connected Bradford, where they pull data together from multiple different sources into one platform, which allows this sort of rich analysis to be carried out. So this starts to set up where we want to think about with going forward with air quality monitoring. We have these gaps at the moment in what we know about buildings. We have lots of short-term data from research studies, but we lack longer-term longitudinal data. We lack the geographic spread in that data. We lack the breadth of different environments. Most of the data that seems to be has been measured today is in homes and public buildings. We often have very limited data. You know, there's some baseline temperature, humidity, and ventilation parameters, but there's very little else out there. And even when people are measuring, people use different approaches in different places, so there's a lack of consistency in there. So I think there are a lot of gaps in, you know, and those are very understandable gaps around resources, capacity, and technology. So where we've been thinking, and we've been working with quite a number of people over the past 18 months, is thinking about whether there is the potential to set up something UK-wide, which could collect long-term time-varying data in many, many different buildings. In the same way that we have outdoor air pollution as a national data source, we have, and that's available and feeds into policy. Could we have something equivalent for indoors? And we need this for the evidence. So without this data, we can't know how well buildings impact health. We don't know what the long-term impacts are. We don't have the platforms to be able to do the right measurements. But we're now in a position where, even though those lower cost sensors are perhaps slightly less reliable, we can deploy lots and lots and lots of them and do longer term measurement in multiple locations. So the idea of an observatory is we would have participatory buildings, ideally across multiple sectors, that would be able to collect data in real time and provide that data to researchers, to policymakers, to practitioners via some sort of central portal. And then that would enable collation and analysis of that data to provide evidence to support changes in how we do manage buildings, to support how we manage health, as well as things like energy, climate, etc. And would also tie these in with outdoor data as well, so we can join that picture up. Two different approaches which could be implemented independently or together. One is to think about having long-term monitoring in a set of buildings committed for a long period of time, maybe 10 years or so. So we collect information to know how things are changing over time, and you can then look at things like interventions and whether that makes a difference. It's probably not feasible to measure every pollutant in that way, because of, it would just spiral out of to a point which was unfeasible. So maybe within this we could have also targeted campaigns where you might do a shorter campaign on a subset of buildings, where to look at more detailed aspects of particular pollutants or to look at particular health effects. And to just give some examples around the world, and I'm sure there are many more that we could pull from, but to give some idea of what is available. So this is in the US. Boston Public Schools during the pandemic set up CO2 monitoring in all of their schools. And this is all live linked to a dashboard where the CO2 can be visualized. And this can be used then by both the public to look at the quality of ventilation in schools, but also by Boston Public Schools authorities to be able to identify where there are problems and intervene. So I think this is a very good example of showing where sensors in multiple locations can be networked together to provide that real-time visualization. I guess one of the perhaps questions or challenges with this is, how much does this just visualizing enable change and come back into behavior change, and does it actually make things better on the ground, or is it just data for data's sake? So that's a real question that we would have to address with some sort of observatory. In France, they've had an air quality observatory for around 20 years. And apologies, this slide is in French because it came off their site, but essentially their observatory operates in such a way that they don't have long-term monitoring. They go in and do targeted campaigns, but very large campaigns. So this one is a campaign where they went in and measured air quality parameters in schools. They had 301 schools and measured 71 different pollutants. And you can see how geographically distributed that is in France. And this allows them to build up sort of rich pictures of the geographical variation, the variation by climate, the variation by different building types. And I believe in France, when the Notre Dame fire happened in Paris, and there was concern over exposure to pollutants resulting from the fire, they were able to go back to the data measured in schools locally and be able to say, well, this is what we knew before. Now we can go in again and see whether any of these levels have been raised and see whether it's a concern. So it does provide that backlog of data to be able to look at interventions, but also look forward if there are particular problems. And then the other last example I was going to mention is one that we've been working on, where we've been doing an intervention study in schools in Bradford, looking at putting air cleaners in these schools. This is in a much smaller scale in a sense, so it's not really an observatory, but the thing that enabled this project to happen was we had over 300 classrooms involved, and every one of those classrooms we put an air quality sensor in that linked into a live data feed. So that meant we had all of the data from the classrooms on carbon dioxide, particulate matter, temperature, humidity, to be able to put that together with illness absence data, and therefore be able to understand how air cleaners were impacting the air quality, but also how it was impacting illness. And we did see a reduction in illness absence, underlying reduction around about 20% in the schools which had HEPA filters in them. So we can start to use that data to be able to say interventions, what's the impact of this intervention in a particular setting. So what have we done so far? We've taken a number of steps. We started in April 2022, working with a meeting in Paris where we were working to understand how they had set up the French Observatory, what we would be interested in doing. We have done this jointly between our network, so the Future Urban Ventilation Network, and another network called the Tackling Air Pollution at Schools Network, and led by Leeds and Imperial College. We've also followed that up with a meeting in London, September 2022, where we went through indoor air quality monitoring, including, already mentioned, the Belgian example, where we sort of spoke to speakers from there. We had speakers from various other places who've implemented certain amounts of air quality monitoring from an academic perspective. And then in May last year, this year even, we had a facilitated stakeholder meeting to really try and set out some principles of this. So that stakeholder engagement went right across government and a number of other sort of public stakeholders. We're well aware that we've really only scratched the surface, because there's an awful lot of stakeholders out there, and we very much haven't really engaged with practitioners and industry yet, but started to set out where this might go. And the themes that came out really did support the original vision for how what an observatory could be. So I identified that whatever was put in place would have to be large scale. You need it to be beyond a normal research study. It needs to be more of an infrastructure than research, and at least 10 years. Needs to be supported by actions, and that's perhaps a question for this group of people here, because we want to know what sort of questions data could answer. There's no point just measuring things and getting data. It's obviously nice to have data, but data for data's sake is not useful. We need to be able to say, well, what could this enable if we can collect this data? It needs to therefore be challenge-led. So the primary focus is we need data to support how we make buildings better for health. But also there's a very big opportunity around climate and energy, because you can collect information on building performance and the net zero interventions at the same time. It needs to, whatever framework is in place, would need to be able to enable interventions to be tested or solutions to be tested. So for studies within studies to explore, could you change things, and then use that to evidence-based new policy, new guidance, new practice. We also recognise that it's important that we put inequalities or equality at the heart of this. So data on indoor air and health has a benefit to everyone, but we really need to think about who are the most disadvantaged groups, where the greatest benefits could be realised by understanding more about exposures and health impacts. I think another key principle was around co-production, so that whatever is designed can't just be a sort of top down, here's what a bunch of academics thought we should have. It really needs to be designed thinking collaboratively with stakeholders. And I think there's opportunities in there to include citizen science type models in there as well. And then participants who are involved will need to benefit directly, because obviously whatever goes in here will rely on measurements in multiple different buildings. And there are questions which should have to be discussed around privacy, around access for sensors, around who owns those buildings, and it will be different in public buildings to privately owned workplaces to homes, but ultimately whatever happens needs to be able to benefit directly the people who use those buildings, as well as provide national data. We've done a little bit of survey work already with the indoor air quality community, who unsurprisingly are supportive, but we did carry out a survey at the Clean Air Networks conference. Everybody thought this was a good idea, and suggesting the locations where types of buildings which people would be interested in monitoring. And really it's quite broad across the majority of building types that people are interested in. And similarly, when it comes to measurements, there's a clear agreement as to what would need to be measured. So, temperature, humidity, carbon dioxide, particulate matter, VOCs are fairly high on the list. Also, NO2 comes up there quite a lot. Less interest in ozone and biological pollutants in this initial survey, but thinking about what parameters would need to be measured. So this is really to just highlight, this is something that it's an ambition at the moment. We are aware that such an ambition would require very significant funding. Obviously, persuading government or research funders or both to provide that funding may well be quite a challenge. And we're also aware that you couldn't possibly measure every space in the country, so you'd be getting representative data. But we think there's enough in here to start to pursue how, really trying to look at the detail of what this would entail, what the nitty-gritty of what an observatory could or couldn't do. And our sort of next steps that we picked out here are much more around further stakeholder mapping, where there is existing data, what parameters and how you would measure, how you ensure your quality of data, how you ensure data gets integrated together in the right formats, how we can visualize that data in a sensible way, how we deal with the privacy and legal aspects of that data, and where the public come into this. So our next steps are around continued interactions, stakeholder groups, and we're in the process of putting together over the next 12 months a sort of white paper or roadmap around what this would look like. I just want to finish up with a blatant plug as well. So for anybody who likes ventilation, which I assume is most people here, it's World Ventilate Day on the 8th of November. Please try and use it, social media, do events, do things, try and engage with it and try and promote it. It's a really good opportunity to push ventilation as being important. And the last thing is to say, well, I'd like to open up to some discussion now, but we would really like your help, your input to this. You are a very important group of stakeholders in this, and to think about where air quality monitor, indoor air quality monitoring particularly, is going to be important for you, not just in the context of an observatory, but actually how it's important for you in the roles that you do and where you sort of see that going. Whether the data from an observatory could be important and could help for you, whether that's in actual data from buildings in your town or city, whether it's about having benchmarks to compare against, whether it's about that sort of wider national conversation about air quality. thinking some of the practicalities about what should be measured, how could you use that data, who could partner with it, who would need to be engaged with it, and the types of questions it could answer. So we have put together a short survey. It is, you know, completely and utterly optional. You don't have to answer all the questions. You don't have to answer any of the questions. But we'd really appreciate your views on that. You know, we'll use this survey to sort of understand where where your interests are, in a sort of anonymous way. So there's a QR code there, and then I've also written the web link on there because I know not QR codes don't work for everybody. So at that point, I'd like to I'll stop talking and I'll just leave that on the screen for a few